say I bring my 12-year-old daughter to you. 3 days ago, she said that she's non-binary. She wants they, them pronouns. What happens to her from there?
So initially, I would try to be encouraging you as a parent to find a therapist and start working with a therapist for your kid. But the minute you're talking to me on the phone, you have already started on a pathway. Because the only therapists that I have to refer your kid to are therapists who are going to affirm their gender identity, not...
Keep in mind, it's illegal now to not immediately affirm these children. If a child comes to a psychologist, if he says, and the kid says, I'm in the wrong body, I'm in the wrong sex, if the psychologist asks one question, are you sure? That's it. He can lose his license. That kid could turn him in and get him, just like you disbar an attorney, you know what I mean? He'll turn him in, and that guy will lose his license. If it's any kind of pushback, even one sentence like, hey, are you sure?
Not question it at all. And potentially, as soon as I say, take your kid to that therapist might see them for 1 or 2 visits and send them right back to the center to get started and seen by the people that prescribe hormones.
So 3 days ago, my daughter said, I think I'm non-binary because she saw on social media, let's say. I bring her to you. You send us to a therapist. Therapist sees us a couple of times, sends us back to you in order to see a doctor to be prescribed hormones.
Potentially, yes.
Jesus fucking Christ. Sorry for my language. Okay.
Yeah. So I think this is a very important part of the conversation, because someone I know very close to me had a double mastectomy, and that is a very, very serious operation. It's a very serious operation. It can, and you know this better than anyone, it can take months to recover from, and actually the risk of complications with such an invasive type of surgery, the risks are high, to put it mildly. So let's look at this. What do we mean by puberty blockers? What do we mean by these drugs? And what are the potential side effects of these drugs?
So the puberty blockers we were using were mostly their implants that go into the arm, or their injectables that are used on a monthly or 3-month basis. In our center, you had to be at least in the very initial start of puberty to get a puberty blocker. But one of the things we were starting to see was that some of the kids put on the puberty blockers, mental health was getting worse once they started the blocker. And that's against what the narrative tells us. The narrative says these interventions are supposed to make people better. And
yeah, the reason they don't make them better is because that ain't their problem. If they were all trans people, all transsexuals, then yes, maybe you'd have a good turnout of people at least being satisfied right now. They're not going to be satisfied later on when they find out they're going to die and have all these medical problems their entire life. But at the time, being a child, getting the blockers, if they're trans, yes, they're going to feel better, but none of them do. Why? Because none of them are trans. They're all gay or autistic or, just depressed, or they're just what we would call goth back in the day. You know what I mean? They're just kind of outcasts that like to put makeup and fingernail polish on. You know what I mean? But now we call them trans. Everyone's trans.
What we were seeing was parents calling and saying, my child has had the blocker in for a month. They're crying every day. They've had the blocker in for 3 months, and they're now failing out of school. Things that were supposed to be getting better were getting worse. In the center that I worked in, I started there when we were still supposed to be operating under the WPATH guidelines, standard of care 7, which had some age kind of ideas for when people were supposed to start hormones. WPATH 7 was supposed to be 16, and it said only in rare and kind of urgent cases, should you be under the age of 16. We were pretty much putting anybody on testosterone at 13 and a half if that's what they wanted and they got to us in time.
And what does that do to you if you are a young person who's been given testosterone?
So,
young girl.
Well, it depends. So if you
young
were
female
on a block,
assigned at birth, sorry.
Well, no, even if you were given a blocker first,
okay,
and we blocked you and then put you on a cross-sex hormone, we are potentially basically causing you to be infertile for life. And testosterone,
sterilized.
The effects that kids reported that they wanted happen pretty quick. So we would permanently affect your voice, and your voice would be dropped into a male pitch. You would see growth on your clitoris into what we would refer to as a micro penis. We would start seeing atrophy, and your vaginal canal would start to have atrophic features. All of your body fat would start to move and shift around. You would have facial hair growth. A lot of our patients would start losing the hair on the top of their head. And then we would see mood changes. We would see patients who were, again, they're supposed to be getting better. Their mental health was supposed to be getting better. A lot of times it was not doing what we thought it was going to do. And if you were on feminizing hormones, you would start growing breast tissue, your fat would move. And again, if you were put on blockers first, it would render you potentially infertile for life. And now we also know for the kids, the boys, if we block you and put you on feminizing hormones, we also are potentially making you have sexual dysfunction for life.
What do you mean by sexual dysfunction?
So in the boys, blockers make it so that they never grow the penis or the testicles. If you never go through puberty and you never have those hormones affect that area, you are left with the same kind of penis size that you would have, that kids have when they're little before they...
See, hormone blockers do not delay puberty. Puberty blockers, they stop it and prohibit it from ever happening. So even when you stop the puberty blockers and you start your cross-sex hormones, you just skipped over puberty. Your genitals are going to be the same size as a 5-year-old or 10-year-old or whatever.
Before they go through puberty. And then also, we knew that the feminizing hormones would make it so you had a lot of erectile dysfunction, the testicles would shrink and atrophy, and we would be causing changes to that part of the body that were irreversible.
I hate to state the obvious, but those are some pretty major changes for a young person to undergo and experience.
And the fact that a young person could have that start happening to them after seeing a therapist twice and an endocrinologist once, to me, does not ethically line up.
One of the other things that we should also talk about is, it came to a point you talked about in your article that sometimes there were situations, particularly if it went to court, if parents disagreed about this, that you had a situation that you talk about where the mother, who was quite disturbed, based on your recollection at least, insisted that her daughter, who wasn't particularly a typical case of someone who was experiencing genuine desire to transition, was encouraged to transition by her mother against her father's wishes, and the center where you worked for was essentially the one that was giving the recommendation to the judge and made the recommendation that it should be the mother's opinion that essentially comes out on top. So a parent was in a situation where the child was going through all of this without even consenting to it.
Right. We have that happen quite frequently. And right now in the United States, it seems like in the courts, the parents who want to give these drugs are the ones that are winning in the custody cases, which to me, it just, oftentimes the parents who didn't want to give the drugs, all they were asking for was more time in therapy. And even they were losing. They're losing in court. And I think in part because doctors like the doctors that worked in my center would show up in court and testify on behalf of the parent who wanted to give the drugs right away.
Why is that?
Why would they do that? Because it's the part of the ideological mindset that the thought is that we have to give these drugs right away, or else these kids are gonna be harmed somehow.
And you say
They tell them that they're going to commit suicide, and they scare the parents to death. What's funny about this whole thing is, right, they act like they're inclusive and they're not racist pieces of garbage like they always do, and we all know they are racist pieces of garbage, right? Everything they do is about racism and putting us in boxes, right? But if they're so accepting, right, and they believe in all these genders and they believe in blah 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 blah, why don't they just let people be who they are? Why are they, like, if you're a femme man, why can't you just be a femme man? These people tell you, no, that's dirty and disgusting. Everyone has to be a straight male or a straight female, and they have to be, you know what I mean? It sounds like the same people before who used to say that, gay people were disgusting and only straight people were good, you know what I mean? Doesn't it sound exactly like that? Because they're not, every time someone who doesn't have fit the stereotype of a male or a female, they're automatically giving them sex changes because they want them to be normal. They want them to fit in this straight, you're not a femme guy, you're actually just a woman. You're not gay, you're actually just a woman. We're going to fix that so you can be normal. You know what I mean? Like they were normal. You idiot. You're the one who's a racist piece of garbage. You want to erase all the people that are different so that everyone is the same. They act like they're inclusive, but they want everyone to be the same. They want everyone to be male and female and act straight. You know what I mean? So, and if you ain't that way, they're going to do sex operations and all this stuff on you so that you are, so you conform to this straight, hetero, male, female thing that they got going on. They want you to be two genders, but yet they say there's millions of genders. Well, if there's millions of genders, why don't you leave them alone? Why do you have to do all these, why are you doing all these things so you can create only two genders in society? Like, it's not, that doesn't sound inclusive.
Ideological. Is there not evidence to say that, if you get in there early, you can say, that's the argument that people make, you get in there early, you save them the discomfort of later life developing, the anatomy of their birth sex, etc. Is there evidence for this idea?
Not in the kinds of patients that are presenting currently, and it depends. So if you look back at the original study, it's often referred to as the Dutch study. If you look back at the original study, they were screening out patients who had mental health concerns because the goal of that treatment was, yes, to treat some dysphoria, but there's not evidence that this treats major depressive disorder, borderline personality disorder, autism. That's not what this is evidence to treat, and yet the argument is that if we can medicalize somebody, then all of their other mental health issues will somehow be alleviated.
Is that a lot of the new cases that you saw over and above what you expected, these were very different profile. They were not boys, they were young girls who were presenting with eating disorders, autism-like symptoms, etc., right? That's
Absolutely.
why you bring it up.
Absolutely.
Yeah.
And they are girls who oftentimes there is a disagreement. So they will claim that, I felt like this my whole life. And their parents initially will often say they had no gender issues at all as a child.